So I am actually having early signs of cervical cancer. I'm actually having one.
Hey guys, welcome back to my channel. You know, it's a girl JJCURVACEOUS, of course. If you're new to this channel, I do motivational talks, weight loss tips, girl talks, and occasionally your girl bring some spicy, hot, trending YouTube games. But from the title of this video, you know what we're about to talk about: my cancer scare and what to expect when you go to do a pap smear. What are some of the do's and don'ts in doing a pap smear? But before I go any further, make sure that you click the subscribe button right down below. If it's in red, that means you have not subscribed yet. Like, what are you waiting for? Join the gang. It's festive over here, okay? Turn on your post notification bell so you get notified every time I drop a video. Those who really do not know, lost my mom from cervical cancer back in February. So this is a road that I dread ever having to go down again. I was really saying, God, can someone be this unlucky? I recently just lost my mom and now I'm having like cancer symptom, like early cervical cancer symptom. This is a clip to show you guys what I was going through. Take a look.
Hey guys, so I am actually having early signs of cervical cancer. I'm actually having one. I am gonna make an appointment to go and see my gyna and find out if the sign that I'm seeing is something else or what I fear the most.
I just insert that small clip just now to show you guys that what I'm talking about now is no joke. This is serious. That same day, I decided to go and do a pap smear test. Now, some of the early signs of cervical cancer are bleeding after intercourse, having abnormal bleeding in between menstrual, increased vaginal discharge, another one, bleeding after menopause. The one that scared me the most and have me thinking something was really wrong was I was having constant cramps and pain in my lower abdomen and also my lower back that like keep on getting worse and worse each day for no particular reason. After intercourse, I was also having a little spotting. This has never happened to me yet on this earth. Just irregular spotting overall, even when I'm not supposed to be spotting. So it was a cause for concern for me. I really started to get worried. My anxiety kicked in. I was just going crazy, guys. That same day I went and booked a pap smear. Now, a pap smear, guys, is a procedure used to detect early abnormal cells around your cervix that can possibly turn into cancer. Now, when you go to do a pap smear, they normally check for a HPV virus. This stands for the human papilloma virus, guys. This virus is contracted between sexual partners. So if you have more than one sexual partners over the year, you're more at a higher risk of getting the HPV virus and more prone to cervical cancer. Cervical cancer can be inherited, guys. The chances are you're more likely to get it from the HPV virus. Now, because my mom just passed away from cervical cancer, I had to make sure that I was in the clear. And so today I'm just going to tell you guys what to do when you're going to do your pap smear, what's not to do, and some of the questions I wish someone had told me before I went to do my pap smear. I went to the Bay West Health Clinic in Montego Bay to go and do my pap smear. A pap smear is a procedure in which they insert a plastic speculum inside the vagina. It can be plastic or it can be iron to open the walls of the vagina so they can see the cervix more clearly. Then a sample is taken from your cervix to be sent off to the lab to check for the HPV virus or to screen if you have any abnormal growth. I read a lot, but for some reason I did not know. Females should start taking their pap smear at the age of 21. After 21, you start to do your pap smear like every year. If you do your pap smear 2 consecutive years and it comes back normal, you can start taking your pap smear every 3 years. You also have a test where you can check for the HPV virus. So if you do your pap smear and an HPV test at the same time and it's all come back clear, then you can do this procedure like every 5 years. Even if you're not sexually active, start doing your pap smear once you're over the age of 21. I was so ashamed when I went to do my pap smear and the gynecologist asked me when was the last time I did my pap smear. Guys, the last time I did a pap smear was over 12 years ago. That is bad. You should never as a female, never allow yourself to go that long without doing a pap smear. At least every 3 years, make sure that you go and do your pap smear. I chose to go to a gynecologist because of what was happening to me at the time, and I wanted to get someone that is experienced. I didn't just want to go to a regular practitioner because I thought to myself, my personal belief was that a gynecologist would be more experienced in that field. So if they cite something that is abnormal, because I was having irregular spotting, lower abdomen pain, back pain and all of that, and I was really numb all the way down there. So I wanted to get like a vaginal exam at the same time to make sure that, you know, little miss is good. When you go to do your pap smear, it is best you wear comfortable clothing, whether a little dress or you wear a skirt suit, something that will not confine your body or have you uncomfortable. The more comfortable you are, trust me, you realize that you're more relaxed while doing your pap smear. They will ask you to remove your undergarments. So if you wear a skirt or a dress, you know, you will not be totally exposed. You have a little bit more privacy. So when I went in there, told him what was happening to me, why I came, he said to me that I must go in the examination room, take off my undergarment and lay on the bed. He gave me a gown, like one of those hospital gowns, to put over me and told me to lay down on the bed and pull my bottom to the edge of the bed. Then when he came in the room, he took out the 2 irons that are normally on the side of an examination bed, the stirrups, and told me to put my foot in them and come down more. He took out his speculum and he told me to be as relaxed as I can. In order for it to be less painful, it's best if you try to relax. I know the stigma behind why most young girls tend to stray away from not doing their pap smear is because they don't want anybody just looking at little miss like, hello. We are all big people, right? We are big people. We are do the things them. If we just start do the things them, we're big. So if we can do the things at home, we can go do one like a pap smear. The spatula that he used was a combination of spatula and a little brush. You see the picture here. Now they insert that down into the vagina until it touch opening of the cervix, and they would turn that part and scrape off some of the cells off your cervix. So it's best when you're going to do your pap smear, you walk with a panty liner or a sanitary napkins, because most time chances are you might spot a little after you get your pap smear done. Another ridiculous question, I did even research that, if you should shave when you're going to do your pap smear. People do research that. Now, to be frank, don't let this be the reason why you don't go and do your pap smear because you didn't get a chance to wax or shave. If you want to, you're free to do that, but it's not necessary. It's not the outside you're doing anything to. We know that we want to be groomed and clean and nice, but chance if it's low and okay, you don't really have to pressure yourself or turn down a pap smear because you said, oh, I didn't get a chance to go and get wax, or oh, I didn't get a chance to shave. According to Mayo site and a few other sites that I've researched, they said that it's best to go and get your pap smear done when you're not on your period or period will be due to make the appointment. You can still get your pap smear done, but if you're on your period, there might be a possibility that your pap smear might not be 100% accurate. Another thing that I found so ridiculous in Jamaica, I don't know if it's in Jamaica alone, they said it will take 1 to 3 weeks. I had to wait a month, 1 whole month to get back my result, guys. And you can see the state that I was in. I was worried. I couldn't think. I could hardly eat. I was having anxiety attack because I didn't know what was going on. The pain in doing a pap smear on a scale of 1 to 10, I would say it's like about 4.5, 5. Probably for you, it will be a little less, but that was for me. After I did the pap smear, I did experience a little cramping for like 3 days. And down there, like I could literally feel my cervix felt sore. And that was for like 3 days. I feel your body tells you when something is wrong. All you have to do is just listen to your body. And even when I came back from doing my pap smear and he was saying, there's no cause for concern, I must just go home and relax and wait on my result, I was still not having it. I felt like something was wrong somehow. So I went and I did all the STDs. All of them came back clean. Your girl clean right through, period. Went and do my ultrasound come back. Nah, man. Girl did really stress because my daddy just gone. And it was taking a toll on me more than how I thought it was. I waited the 1 month and I got back my result. Thankfully, praise be to the Most High, my result was normal. There were no abnormal cells or anything for me to worry about. And I was also taking some pills that I did not know was hormonal, and that was what causing me to be having all of those symptoms, caused all of that drama in my life. If I was doing my regular pap smear frequently, when I was seeing those signs, I would not be freaking out that much. I wouldn't under so much stress. And one of the worst things you can possibly do when you're sick, go and Google and research the symptom. If you research that your head hurts you, it's going to tell you say you have some form of cancer or AIDS or something. Best to just go to your physician and get yourself checked out. I have not seen any more signs, so I have to give God thanks. Listen, if you have not done your pap smear within 3 years, go and do your pap smear. Pap smear is 90% more effective in catching abnormal cell growth that can possibly turn into cancer and can save your life. If my mom was 50 when she died. Pretty young, right? 50 years old. She should just be ready to be living her best life. but unfortunately she's not here anymore, and this was one of the reasons why she was not doing regular pap smear. So when she was having these signs and symptoms, she thought it was menopause. She didn't went to the doctor until later on down, and by the time she went to the doctor, she did a pap smear. Her first pap smear came back inconclusive. They told her to come back to do a pap smear within 2 weeks, and for some reason this lady never go back. She never go back. When she finally started losing weight and everything, and she went back to do another pap smear, her pap smear came back with she having stage 3C cancer, basically stage 4 cancer. She did fight a lot. She did fight a lot, but in the end, her cancer was already too advanced for even radiation or chemotherapy or surgery to work for her. So she succumbed to that. So this is one of the reasons why I feel so passionate about this, and reason why I was so worried. Just take my word for it. If you have not done a pap smear in the last 3 years, if you're a male and you're watching this, go to your wife, go to your girlfriend, ask them when last they did a pap smear. If you need someone to go with you for you to feel more comfortable in doing your pap smear, take a friend or take a family member with you and go and get your pap smear done. This video is a tribute to my mom, because I know that if she had more information at hand and she know really the signs or the early signs of cancer, and know that she was having these signs and go and check with a doctor what was going on, she would probably be here today. Don't make the same mistake my mom made. Okay, you are loved and your life is valuable on this earth. Until next time, it's your girl JJ Curvaceous. Mwah.